My name is Nathan Dias, and I'm the CEO clerk here at the Township of Schreiber. Our conversation here today is on reopening and how that has impacted the municipality and its facilities and programs. Um, Part of where we are right now at this current stage, and it took us quite a bit of time in order to get here because COVID basically took us and the whole world by storm, and it was what kind of impact is this going to have on the workplace? What kind of impact is going to have on our residents' day-to-day life? And going into it, while all the information was collected by our experts and World Health Organization, and part of the challenge was to keep up with all of the regulations and new information that was coming out. And a very key aspect of all of this is understanding that COVID-19 was treated as a workplace hazard. So that was number one, particularly for the reasons of why the municipality was shut down. It's we had to look at keeping our staff safe, and we had to look at keeping our residents and customers safe, and really treat it as a OSHA workplace hazard. Going forward with regards to reopening, I think a key aspect that led us to where we needed to be was putting together, again, a plan in terms of how we're going to reopen. And part of that was the bylaw that we passed with regards to COVID reopening and protocols and procedures. And the main key element of how we came to this decision was, again, the planning aspect in figuring out what kind of legislation, what are the statutory regulations that exist, what that will be the bare minimum that we need to meet in with regards to reopening. And thereafter, how do we ensure a balance between our workers here, our staff here, and the residents? And the key is finding that balance between safety and also for civic freedoms. We want people to still be able to enjoy municipal facilities and programs, but we need to ensure that it's done in a safe way, in the safest way for our staff and residents. There is still so much unknown about COVID-19. For some people, they show no symptoms. For some people, the symptoms are very drastic, and it's really difficult to go about this because, again, when you're thinking reopening, whether it's staff that's going to come into contact or residents are going to come into contact, you're dealing with a situation where no one really knows, even if they may be possibly positive with COVID. And that was part of the challenge in terms of figuring out how to reopen. And there's a lot of logistical issues. We're talking about cleaning lists, disinfection schedules. All of these logistics have to work together in order to create that atmosphere where there is put into place enough thought over every procedure we do, out of every program we do, to, again, ensure that our staff is safe and to ensure that residents are safe. So it took us a while to get there to the stage of reopening, but when we opened, part of that plan was, again, to do it logically and sensibly. And it's part of what we've been trying to figure out internally is the scale of what's the safest things to open, what are the things that have the least amount of logistics to do it right. So, for instance, opening up the building to just our front counter services, that was something that was pretty straightforward to go ahead and plan. Again, we had to make sure we got disinfectant. We needed to make sure we marked the spots where people would line up. We had to make sure that we had a barrier in place. It has to be noted that the change that a lot of residents feeling, it's also there again with our employees. And you talk about the stresses of not only dealing with this pandemic, but also now your whole kind of schedule is kind of changed in the workplace because you're now cleaning things in a different way. There's all kinds of rules with regards to how you interact with visitors and where you can interact with visitors, when you're supposed to wear a mask and where you're supposed to wear a mask. So there's just so many areas where we had to cover and so many areas where we'll have to continue covering. And part of that, again, is to have that sort of list in place where we look at, okay, this is what we can open now. What's the next area that we're going to look at? So, for instance, the front counter of the municipal building, that one was fairly straightforward to open. We put in a barrier there, and we had our staff trained with dealing with customers. A more complex kind of situation is reopening the gym at the municipal complex. It brings into question who's going to be disinfecting equipment, all that equipment that's going to be used, on what intervals will our staff be going in there, what are the expectations to disinfect there. I say a very complex one is a weight room. I know that there's a lot of residents who are eager to get back to exercising again, and that one is a difficult one. We're talking about, again, people coming into a very confined area. The equipment may not be spaced apart at the required 6 feet. We want to ensure that the air quality is decent for people exercising there. And again, it's limitations with regards to the amount of people who can be there. So we're looking at whether we're going to do an appointment-based system, and just considering all the different options and then balancing it out. What are the risks to our staff? How much staff involvement is going to be there? What staff involvement is going to be feasible and practical for that area? So all of that plays into work with regards to our reopening plans. Specifically with the senior center, the main concern that we have is, again, the user base is highly vulnerable to this pandemic and this virus. And key element for us is again, to ensure that we're not putting them at any risk by incentivizing them to go out of their house or a safe place in order to get out in the community for a reason that may not necessarily be mandatory for them. Meanwhile, we are looking at the senior programming to go into the direction of kind of virtual programs if we can. And it's, again, complicated. We're talking again about doing virtual programming, again, for a user base that is going to find it very difficult to adjust to this kind of virtual training. So part of it is looking for funding opportunities and reallocating resources there where we can have people still interact with the senior center and programming, but in very different ways. And I'll say a key aspect of this is, the senior center has not closed during the pandemic and has made pretty big breakthroughs with regards to applying for grants that have been really beneficial for our seniors. The Helping Hands hampers, for instance, was a great way to still contribute to our senior center members. And we're still looking at many other grants and other ways to find that kind of programming best we can. In terms of physical reopening, that's something we have to monitor very closely and again, just see the data that we get with regards to COVID-19. And if the numbers continue going down, the number of cases, then we'd feel more comfortable with getting to that stage of reopening the senior center. Another area is our outdoor facilities, whether it's the playgrounds or the ball field. That was another area where we had, which we have just recently reopened. And again, a key aspect for that was, again, look at what the statutory requirements are according to the province. What are the guidelines from the health unit, if there are any? And go from there and then put into place our policies to make sure that, again, when people are using it, they're using it safely. And in some cases like this, where the disinfection of a whole ball field or a playground isn't very practical for us, it's to put those notices on the equipment saying, hey, there's just no way we're going to be able to disinfect it, and do understand that you're using it at your own risk. And hopefully that risk will be low, again, because we have very few cases in Northern Ontario. A key aspect, again, with regards to travel and everything here is the health unit really, the Thunder Bay District Health Unit really does set the standard when it comes to looking at, again, the guidelines and policies with regards to this. And a very key one is that the travel isolation is lifted for people traveling within Canada. So as far as the experts' recommendations, as far as that goes, it's they've cleared people to travel without any sort of isolation. So it's very difficult for me to judge anyone who's traveling anywhere. And it's another key aspect is, again, that a lot of people aren't going to be doing any international travel with all these restrictions in place. And that means there's going to be a lot of people who are traveling within Canada. And for a lot of people from Southern Ontario who want to come up north, and this is a beautiful place, I don't blame them. We can't control everyone else who's traveling, but you can take measures to protect yourself. And certainly wearing a mask when you're out there in any sort of public space. This was, again, another requirement actually put out by the health unit for any public spaces. That's going to be really key in order to protect people, and at least in my opinion, when it comes down to people from Southern Ontario, Northern Ontario interacting together in these public spaces. We actually have put in quite a strict travel policy. If anyone is traveling out of Northern Ontario right now, or coming into contact with prolonged contact with individuals who have been outside of Northern Ontario, we do have a mandatory 14-day isolation. Not all our staff are able to work from home during this isolation, but a key element for that is during those 14 days, if they are on municipal property, and we do require them to wear a mask. And that's what's going to be our key element to ensure that our staff are safe when interacting with each other. I think a key element, again, with regards to how even council meetings are conducted and how employees are interacting, again, with regards to masks or no masks, we have a lot of policies in place that thoroughly cover when masks are required and when they aren't. And our employees and councillors are screened based on, again, if there are in any circumstances where they could be at risk for COVID-19, that they would let us know. That has all played, a key part in determining who can show up for a meeting and who may participate in a meeting electronically. I think it's a key point to say that we're, again, very fortunate that Schreiber has our electronic council meetings where, or I should say that we live stream our council meetings, and we were doing this well before COVID-19 hit. And that really prepared us in order to, in terms of process, to continue what would be a new process to a lot of municipalities. And we have the infrastructure in place so that any of the councillors, if they ever needed to participate electronically, they have that opportunity to do so. A key element, again, to determine that, whether they're going to do that or not, is, again, if they traveled anywhere outside of Northern Ontario, have they come into contact with anyone for a prolonged period of time who has traveled outside of Northern Ontario. those would be factors in determining whether they were going to show up actually through an electronic delegation or in person. That being said, with regards to the choice, it's still finding that balance between, again, doing what we need to do, but allowing people the freedom to do what they need to do in the safest way possible. So if we're seeing, again, meetings where maybe not everyone is wearing their masks, do keep in mind that everyone has been thoroughly screened before they show up to that meeting. I think a key element with regards to how our council meetings are conducted here, again, we took into account, again, the appropriate physical distancing for everyone at the meeting. And that is another key component, again, for these meetings is some people have the preference to meet in person just because of the ease of communication that that you get from meeting in person and seeing live reactions to how people interact and how that has an impact on the conversation that we have at the table. I think that there has certainly been, this has certainly been the case where a lot of our councillors see the value in that, still that having that personable connection to each other in the decision-making process. There's so much that is applied. We have to think about, again, we start with what are the legal and statutory requirements, what policies do we need in-house here to effectively get the solution that we need? What is the outcome that we want? How does this policy or protocol then compare to neighboring municipalities, neighboring businesses, and the community in general? Like, we need to figure that all out and find that balance when coming up with these policies. And that's a key element, is we don't want to put into place some sort of very strict policy that takes away, again, people's personal freedoms. We want to make sure that there is that appropriate balance between safety and their personal freedoms. Technically, the bylaw officer, the OPP, and the Thunder Bay District Health Unit can all enforce the province's policies and regulations. I mean, the health unit and the OPP always can, as anything with the province. They extended that ability to our bylaw officers. That being said, we have a part-time bylaw officer that's already quite busy, so we've really deferred a lot of that provincial enforcement onto the health unit and OPP in order to do that. With regards to in-house policies, there's a lot of complexity even with regards to simple rules. Let's just say public wearing the mask, and that was a directive sent out by the health unit, and it's not our full role to enforce every aspect. Let's just say with the example of a mask, because again, it's finding that balance, and there are some exceptions with regards to people, for instance, with health issues who may not want to wear a mask. So as with people entering the building, are we going to question people and ask them about their health and medical history? The key element is, again, us having a mask that we can provide to people should they need it, putting up signs saying that we want you to wear masks, and it's there, and knowing that just again having that good faith and trust that the majority of people will want to follow guidelines to protect their health.